And who do you have with you today, Miss Billy?
Well, this is...
I'm her granddaughter.
And I'm her daughter.
So it's nice to meet you guys.
Right,
Hi.
nice to meet you guys. Okay, so Miss Billy, I heard that you're newly diagnosed with diabetes and you've been prescribed insulin. So, are you aware of how insulin works?
Doesn't it lowers my blood sugar?
Yes, ma'am, it does. And we're going to give you a little bit more information about insulin so that you have a better understanding. But first, when you get your insulin injection, you're going to put it into the subcutaneous tissue of your stomach. You don't want to put it into your upper arms or your thighs or even your butt because it's going to slow down the absorption rate. If you put it into your stomach, the insulin will absorb much faster. Alright, so then, other things that can alter the absorption rate is exercise. You want to wait 45 minutes after you inject before you start exercising. Also, the amount of fat that you have up under your skin will also decrease the absorption rate of the insulin. And then your insulin should stay into your system for 5 to 7 hours. It may take 30 to 45 minutes to actually get into your system, and then between 2 and the 3.5 hour mark, your insulin will reach its maximum potential.
So how does insulin flow throughout the body?
Okay, so after insulin is absorbed into the tissues,
This tissue.
No, Grandma, like your body tissue. Your body tissue.
Body tissue.
Yeah.
it goes into the bloodstream, and there are receptors on tissues that the insulin binds to, and this causes your blood to decrease, and your tissues use the sugar for energy.
Okay. So what would happen if my mom took too much insulin?
Well, if she took too much insulin, it would cause hypoglycemia, which is a low amount of blood sugar in the body. And Ms. Belton, it's important to realize what's normal for your body so that when you have symptoms of hypoglycemia, it will be easier for you to recognize. And some symptoms include depression, drowsiness, dizziness, nausea, and fatigue. And more severe symptoms include coma or even skin discoloration.
I'm drowsy now, ma'am.
Is this like genetic? Like, can it be passed down? Can I get it?
Well, no, it's not genetic, but there are other factors that can lead to chronic illness that will cause diabetes.
Well, I take a lot of medicine. I really can't think of the names of them, but I know I'm on high blood pressure medicine. Would some of that stuff alter what y'all talking about?
No, ma'am, but are you allergic to beef or pork?
Bacon is my favorite.
Okay, Ms. Belton. Do you drink any alcohol?
I have a shot of brown sometimes.
Okay, well, when you're on insulin, you will want to avoid alcohol, garlic, and celery because they increase your chance of getting hypoglycemia, which is low blood sugar.
So what? Bacon's okay, right?
Yes, ma'am.
Okay.
Does age or like how active you are play a role in it?
Well, the older you are, the slower your metabolism is going to be. So that's going to decrease the absorption rate of the insulin. So we recommend that you get some type of physical exercise, even if it's like gardening or walking your dog. That'll be more beneficial to you, not only to raise your metabolism, but to also decrease your risk of obesity. So.
And hypoglycemia, that is.
Yes, ma'am.
Look at Grandma.
So do you guys have any more questions for us today?
No, I think we got it now.
All right.
All right, we'll see you in 2 weeks for your follow-up.